Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. I am Dr. Nyer Firdoose and I am here to present our research on Coronoid Foramina of Mandible. This is a recent discovery in humans, and the oral presentation is about a clinical series of 48 patients, including a pediatric variant. The etymology of the word coronoid process comes from two Greek words, namely the corax and then the coron. And a foramina on this prominent bony structure of orofacial region was recently discovered in 2017, and it was earlier known to exist in pinangulates, and the incidence of the coronoid foramina in live humans is really rare, and therefore the scarcity in the literature. The aim and objective of our present research is to present this unique discovery and determine its prevalence using the computed tomography scans while evaluating its variability in terms of unilateral, bilateral, or gender predilection, and propose the significance of this recently discovered anatomic variant. This is an ongoing study, and then the study is not complete yet. And then till date, from August 2017, we are able to scrutinize 987 radiographs, and then based on the data available, we arrived at three assumptions. And then namely, the dependent variables should be normally distributed, and the samples drawn from the population should be random, and the cases of the samples should be independent. And coming to the analytics, descriptive and inferential analysis was done, and the significance was at 5% level. And statistically, we used the chi-square test to find the significance of study parameters on categorical scale between two or more groups, and the non-parametric settings were applied for qualitative data analysis. Fisher exact test was used when the cell samples were small. And regarding the software, SPSS 2.2.0 and R Environment 3.2.2 were used for the statistical analysis. Coming to the results, out of the 987 radiographic evaluation and confirmation by cone beam computed tomography, a total of 48 patients were identified to have this kind of a variant, and then the variant types were namely bilateral type, unilateral left-sided, unilateral right-sided, as well as a bilateral foramina with accessory coronoid foramina. This table shows the variant type and its association with gender, and then out of the total 987 radiographs evaluated, 288 were of male subjects, and then 699 were of female subjects. And then out of these 699, only 26 radiographs were confirmed to have a variation in females, and 22 were confirmed to have a variation in the males. And then in terms of percentage, the males were higher compared to the females, constituting up to 8% and 3.7% for the females respectively. This table shows the variant type and its association with age in years, and then we assess the radiographs based on the years starting from the first decade going up to eighth decade. And then the youngest subject in our study was 8 years old, and then the oldest subject was 79 years old. And then in terms of age in years, the fourth and the fifth decade, 40 to 50 years, was the most significant period where we were able to identify the maximum amount of subjects up to 16, followed by 10 subjects in the age group of 50 to 60 years old. And in terms of the variant type and its association in the age, this is a significant assessment. And coming to the percentage assessment in terms of the gender, male and female, male certainly were known to have a higher predilection to have this kind of a variation in the mandible or coronoid processes compared to the females, and going up to 8% and 3.7% in the females. And on the right side, you can see a panoramic radiograph of the oldest patient of our research, wherein you can see a vague radiolucency on the bilateral coronoid processes, which are not corresponding to any normal structure or artifacts, known artifacts. In this slide, I would like to show a couple of images from the computed tomography and as well as the panoramic radiographs of different variants. And in the first the first figure shows coronoid foramina and coronoid depression, as well as an accessory coronoid foramina and the coronoid canal. Incidentally, this radiograph also shows a lateral accessory foramina of the mandibular canal. And then the second, the panoramic radiograph shows unilateral right-sided radiolucency on the coronoid process, which did not correspond to any of the normal morphological patterns of the human mandible. And then this is again a 3D reconstruction of unilateral right-sided. And then the extreme right panoramic radiograph depicts the pediatric variant right-sided type. And then the bottom two figures are of a 3D printed model of this unique discovery. And the first discovered case, the files, the data files were converted into STL files, and then the 3D printed models. And then as you can see, this patient had the multiple variations in the supratrochlear infraorbital, as well as the mental and the infraorbital inferior alveolar nerves, as well as emissary veins and emissary foramina and canals in the mastoid processes bilaterally. Coming to the discussions, the accessory foramina are constant structures of human mandible, which are more prevalent in posterior region than the anterior region, and they're almost always occupied by a neurovascular bundle. And the majority of the times they are bilaterally symmetrical, but variations are known to exist in size, shape, and number. And awareness is clinically important, as they can lead to diagnostic and therapeutic misinterpretations. In conclusion, we would like to say that the understanding of such anatomic variations is important, as they may potentially defeat the successful treatment outcomes, and pertinent diagnostic and pre-surgical assessment influences the outcome of surgical procedures, thereby preventing any sort of iatrogenic injuries. And also, it is undeniable that diagnostic to prognostic evaluation of such patients need to be studied further for better understanding of the outcome. Thank you very much.